Welcome, my name is Peter Strong and I'm a professional online mindfulness therapist. I offer online mindfulness therapy for the treatment of anxiety, including panic attacks, the more extreme form of anxiety. So online treatment is very effective as long as you use Skype. That's the main requirement, really. You have to be able to see your therapist. You have to see each other in order for psychotherapy to be effective. And Skype makes that possible. So online therapy is a great choice for many people. It's certainly very convenient and it's also very effective, especially if you're interested in an approach that teaches you skills on how to work with your emotions, in this case anxiety and panic attacks. The goal of mindfulness therapy is to give you the tools to manage your anxiety and other emotions more effectively. That's much more important than taking medications or similar treatment-based approaches. Medications are not going to change the underlying process that causes your anxiety and panic attacks. So it's really important that you get to the root cause instead of just treating the symptoms. And that's the whole focus of mindfulness therapy, is to actually look at how our panic attacks are created in your mind. How does that work? What is the process here that's causing those panic attacks? So there are a number of ways we can go about working with panic anxiety, and I'll explain to you in great detail during our Skype therapy sessions together what these approaches are. So one of the first things that you really need to change if you want to overcome panic attacks is your relationship to your emotions. You must, first of all, not fall into the habit of avoiding anxiety situations. You must not avoid those situations that trigger anxiety. Because if you do engage in avoidance, that will have the effect of reinforcing the underlying anxiety. You're in effect generating fear reactions to the anxiety itself. So we have to take a very strategic approach that's based on developing more conscious awareness of your anxiety. You have to develop a conscious relationship with your anxiety, and that, of course, is what mindfulness training is all about. It's about seeing your emotions directly without reacting to them with fear or avoidance, and seeing them as an observer. So that's another major principle in mindfulness therapy, is developing that quality of your consciousness where you are the observer instead of just falling into the anxiety reaction itself, which is typically what happens. So the anxiety typically gets triggered by some external trigger, or it could be internal triggers in the form of thoughts. But when it's triggered, we simply blindly identify with it. We become consumed by that anxiety. And that's the real problem that we need to address. In mindfulness psychology, I call this reactive identification. And this is the real issue. It's not so much that the anxiety gets triggered, it's that you become identified with it, and therefore you become imprisoned by that emotion. That's the real issue. So the first training is learning to see your anxiety as an observer. We call this developing objective consciousness as opposed to subjective consciousness, which is where you become consumed by the anxiety and overwhelmed by it. The more that you can develop this independence as the observer, seeing the anxiety as an object in the mind, the freer you will become from that anxiety, and you will no longer be feeding it through that subjective reactivity. So that's really important. The principal way we go about doing this is by learning how to meditate on the anxiety. So you would imagine the situation that triggers those panic attacks. You would play it through in the mind in order to access the anxiety so you can meditate on it. And meditation, in its most basic definition, is about cultivating a conscious, non-reactive relationship with experiences, in this case with your anxiety. So we train with the anxiety. We train in a way that we can remain non-reactive, that we can remain as the observer. We develop that objective consciousness. And this effectively takes the fuel away from the anxiety. It stops feeding it, because when you react to anxiety with fear, avoidance, aversion, or even just labeling it as anxiety, the very process of reactivity feeds it. It solidifies that anxiety. But when you stop reacting to it, then the anxiety begins to change and heal and resolve itself. So in effect, you're creating the right conditions for healing. And anxiety will always heal, as the same applies to depression as well, and any other form of emotional suffering. Its natural direction is to heal. What stops it healing is reactive identification. So we train with the anxiety. We train to sit with that anxiety without reacting and helping it continue its natural path of healing. The second part of mindfulness training is developing this objective consciousness even further by bringing in the element of friendliness or compassion. This is a very essential part of mindfulness training. Mindfulness can be defined as compassionate, present awareness. It has these two components: being fully conscious and present with experience, and being compassionate with that experience, or friendly, or even loving in relationship to the emotion. And love is a very, very powerful force for healing. This is well established. When you bring that quality of friendliness and love and compassion to your anxiety, that will accelerate its healing dramatically. So that's another thing we develop during our meditation on our emotions. So we develop more objective consciousness, and then we develop more friendliness and compassion. Also, when we are working with panic attacks, we look very closely at the imagery of the anxiety that gets triggered in that panic attack, because emotions are 100% based on internal psychological imagery. For an anxiety or other emotion to really have any power in the mind, it has to be very large in size. If it's overpowering, that tells you right there that it is probably high in your internal visual field. You see it above you. That's why we say it's overwhelming. Also, if it's overwhelming, it must be very large. So this is all part of the imagery that makes anxiety and panic attacks work. So we look very closely at this imagery, because when you see that imagery, you can start to change it. And when you change the imagery of any emotion, you will change the intensity of that emotion. You will help it heal. So this is defined in mindfulness terms as developing compassion for the emotion itself. We are helping it heal. That is compassion. The way we help it heal is by helping to change its imagery, because that imagery is what causes the anxiety. So we work a lot with imagery, and I will teach you how to do this in great detail. So this approach works really well. So we replay the panic attack scene in our mind, we find the anxiety, and then we develop a mindful relationship with it to help it heal. So we're teaching the emotion how to resolve itself, how to decrease its intensity until we can imagine the situation and not feel that panic attack. Then we go out and do a challenge to test how well our meditation work has been. So driving anxiety is a classic one. So when you've done the work and reduced the anxiety by imagining going to that situation on the roads or on a bridge or wherever that triggers a panic attack, then you will go and challenge yourself. You will go and put yourself in that situation and watch for any anxiety. If there's still anxiety there, then we simply do more mindfulness meditation work on it after the fact and help reduce the anxiety further, and then we go back and repeat the challenge until there is no anxiety. So this is a very strategic way of working with panic attacks, which I call mindfulness-based exposure therapy. If you'd like to learn more about how to overcome your panic attacks without using medications, but by actually learning how to work with your anxiety directly using mindfulness, then do please contact me and let's schedule a Skype therapy session. Thank you.